My name is Dr. Bramall, and I am a neurosurgeon here at Duke Health. I see any patients with any kind of cerebrospinal fluid flow disorders. In addition to that, I also see patients that have brain disorders due to traumatic injuries. But my specialty focus is really looking at cerebrospinal fluid flow disorders. Typically, the symptoms that our patients present with are going to be fairly common symptoms. For example, the most common one is headache. And then second, oftentimes, patients might notice that they have some walking difficulties. Our goal is to avoid surgery if we can. Of course, we never want to put patients under any kind of risk that's unnecessary. And if there is a less invasive way of treating something, then we will take that approach first. Every individual has their own reasons for being there. They have their own motivations. They have their own goals in terms of their own care. And so I think we have to be, as physicians, we have to be exceptionally mindful of the fact that every single person is an individual, and what they want out of their care is going to differ depending on who they are. Sometimes when a patient comes in, you find things you weren't expecting to find. But if you don't have other services to kind of help out, then it's really difficult to kind of take that approach and treat the patient from all aspects. And I think that Duke provides that. So if there's anything that's missing, Duke will have it. I think the other thing that really makes Duke stand out is all the kind of novel treatments and trials, clinical trials that come out of Duke. I think that at other places, patients aren't going to have the opportunity to be engaged in some of those trials. After a surgery the next morning, when you walk into a patient's room, and you greet the families and you talk to the families, and the patient's happy and they've improved in terms of their cognition, or they're able to walk better and speak better. I mean, there's nothing more gratifying than knowing that you've really kind of made that difference, and that's really invaluable.